I'm good.
You're perfect.
I look taller
You're
than
perfect.
you.
Create a new stream. Oh, it okay. It looks like we have an error on Facebook. All right.
Okay.
One of our pages is not streaming to you, but we are live on your page and on
Okay.
YouTube and on LinkedIn. So, guys, hi, welcome. It's so good to have you with us. I do apologize for the error on the one Facebook page. I'm going to try and fix that as Becky introduces herself. But let's get into it. Let's get started. Today, we are talking to Becky Tenges about tack fit dysfunction, how we're going to identify that as professionals, the role that we play, and a few of the nuances that go into the whole horse, how we're assessing the whole horse with a focus on tack fit. So, Becky, thank you so much for joining us today. Can you please introduce yourself? Tell us a little bit about how you became interested in tack fit dysfunction and its role in equine rehabilitation.
Well, good morning or good afternoon, wherever you are in the world. It's morning for me, 5:30 in the morning. Um, so my horse journey started when I was about five, but roll the clock way forward. I had a daughter that had a horse, and then he was lame, and one thing led to another, and I started a journey to learn body work. And my foundational training was with the Masterson method. And in that, I'm also an instructor for that now. And what we do in that is we look for tension and restriction, and then we try to reduce it with how we work. And the other thing our program teaches people is to search for the source. What tension and restriction is always the result of one or more things. And so, pretty early on after I finished my certification, I, one of the big logical ones for me was, well, if the tack doesn't fit, it doesn't fit the horse or it doesn't fit the human or both of them, then that's going to create tension. And even if it fits the horse and doesn't fit the human's going to be tense, and then the horse is going to tense, because they mirror. And so,
Mm.
pretty early on in my journey, I looked to trying to understand tack, and then my brain, once it learns one thing, it wants to learn something else. So I did end up in if you look at my CV, there's a lot in there, but I did end up in a rehab certification program. And so every step of the way, I would say, with all of the training, it's been just gathering more knowledge and information about how the horse's body and its behaviors and performance is speaking to us. And so I just became more informed about all of that, and trying to be a translator for the horse, I guess.
Okay. Okay, I love that. I really, one of the things that stood out for me from your webinar is just how much you love to learn and grow, and
Yeah.
you kind of personify that never stop learning. That is really our motto at Online Pet Health. That is what is the foundation of everything we do is just never stop learning. So I love that. I love that you highlighted the horse-human mirror as well, because especially with something like tack, fit is important for both parties. And that's most relevant probably for the saddle, but also for the bridle and the bit. Both the horse and the human need to be well fitted to
Mm,
that piece of tack for it to really serve its function well. So I love that introduction. Thank you.
yeah.
In your webinar, you introduced the idea of primary issue overwhelm. I think that's a really good point to bring across because with horses, I think especially it's so quick that we get into this loop of where does the problem come from. Can you explain to us what you mean by primary issue overwhelm, and then how do you prevent yourself from getting lost in all those
Yeah,
possibilities?
sure. And maybe it makes sense if you can control the slide just to
Yeah.
jump over and get to the one where there's all the primary issues. That one right there.
This one? Yeah.
And then the one after that. So, uh, we are, as it seems to me, as people, we want to jump to the end of the line, and we perhaps are not always right. And so it's useful, I think, to look at all the possibilities for what the primary issues are. So here's a snapshot. It's not all of them, but it's all the big buckets. For me, the top three are tack, teeth, toes. But then we have the things that could superimpose themselves on top of those things, because the tack and the teeth and the toes and the rider, those sort of exist as a through line. But then a horse can have injuries, or it can have health issues. It could have been born with conformation issues. There might be reproductive issues, their living situation. So, I just have found that it's helpful to have uh, all of the possibilities, even though it might be confusing, and then to begin to rule them out. And so, the next slide is a picture where it's the same list, but in the same topics, but kind of in a list. And how do we? For me, it's first about acknowledging that I need to be humble, and I might have an idea that it's the fill in the blank teeth. Um, but I need to be humble, and I need to listen to the horse, and I need to take in all the information, which is kind of confusing, but that's where this process came for me, where first of all, I want all the information. I want all the information from the people and what they think and what they are hearing or learning or experiencing with their horse, some of which they may say and they then discount. They'll say, well, the horse always does that. I may ask, how's your horse, when you're grooming? Oh, he's just a jerk, but he's always that way. I'm like, well, okay, I'm listening. And no, actually, I don't say this out loud. I say it in my brain. I say, no, the horse is communicating and speaking a language you actually don't get yet. So I think it's really important to get all the information, and then for me, categorizing it in a way that I can try to understand and triage um, what is coming through. And the thing about tack, and you mentioned it a few minutes ago when we're talking about the bridle or the bit or the girth or any additional contraptions that are put on, besides the saddle, to the extent we look in each of those places and we listen to what the horse is saying. And then if we have a system, which I do, for categorizing it, that's how I prevent myself from getting confused, because I just have these buckets into which the horse's dialogue, I categorize it in my head, and then I can we can kind of think about, well, what's coming more forward? Is it something about more specifically about feet? If my feet are a problem, I'm gonna move in a way that a saddle that fits doesn't fit anymore. It's gonna get crooked. If I have a hind end lameness, we know from Dr. Sue Dyson, if we have a hind end lameness, that's going to make saddle slip. Is it a saddle problem? Maybe. We got to look at the saddle, but it's probably a hind end problem. Yeah, I probably have answered that question.
That was perfect. Thank you. I love the tack, teeth, and toes as the primaries. That yeah, that one will stick with me. And the focus on just humility and listening to the horse. Like, don't assume that we know what the answer is. Listen and then listen again, even when we've kind of made our assumptions of where the primary issues might be. Don't assume that that's where it ends. Just keep listening and paying attention to what's happening. And I think that's relevant when we're in a team as well. You've mentioned listening to the owner. What are they saying? What is
Mm,
underneath what they're saying? Like, they're making assumptions about behavior and about what is normal that may not be truly accurate. That
right.
that's kind of lying
Well,
within their biases or their belief systems that don't necessarily support the horse and where it needs to go. So I love that.
yeah. Well, and it can be accurate. I mean, the horse might be being a jerk. but um, but the opportunity is to become more informed, and
Yeah.
and to and to determine whether there are I tend to, when I'm around horses, the little cartoon thought bubbles. I put
Mm.
I put little thought bubbles above, above the horse's head, and I try to go, well, if you could use your words, what would they be saying? Um, and that has actually really helped me. It's kind of silly, but
Yeah.
it has helped me to um, uh, move from the action, which is either dysfunctional or antisocial, um,
Yeah.
to if you could put words, horse, if you had words, what would it say?
What would they
What would they
be?
be? So,
Okay, I'm really enjoying the peek into your brain, Becky. Just saying. So that brings us to my next question.
yeah,
In your webinar, you introduce this concept of body talk and the
yeah,
body talk framework. Can you
yeah.
explain what that is and why you developed it, and how it's changed the way that you approach complex cases?
Yeah, let's see what the next slide is. That might be helpful as I talk. I think it. Um,
Number one?
well, yeah, no, keep going. Those are all the different ways that we can get tension. We're getting there. Um, the next one. Yeah, there we go. So,
This one.
for me, I've kind of already made reference to it. I really do consider that the horse is talking to us. It's just that it speaks a different language than we do. And so if we could choose to get engage in a process where we notice things and how might those be characterized as communication. And so, if there is an alteration in how they move or how their body appears or what their behavior performance is. Those are the sort of the green, the orange, and the blue, and we sort of subcategorize those. That's the beginning of an organized sort of process to try to categorize what the body and behavior and performance are saying. Um,
Mm.
and and then the next step in this process is to, use our own knowledge and ability and to try to confirm because, we tend to see something and then mostly want to say something, but we should we should pause and confirm, and use our, and so for me it's a very sensory process. I want to, and what that does is it creates a half halt. If I see something and like ooh ooh ooh, my brain goes ooh, there's the answer. And then but then I go, well, no, wait, let me listen to the horse walk down the aisle. I think, ooh, it's got some sort of lameness issue, and it walks down the aisle, and I don't hear anything. Like, well, okay, maybe not. Maybe it's just how it moves. So, uh, I think it's important that we use our hands, that we use our eyes, that we use our ears. In some cases, even our sense of smell. I solved a situation where I was brought in to do body work on a horse, and there were just the horse was doing this interesting thing with its head, and within 5 minutes I was like, oh my gosh, there's something rank coming, in terms of smelling the horse's nose. And I said, have we had his teeth checked? The horse had a massive problem inside its teeth. And so, we need to use our senses and take everything in from the horse. So to confirm or deny what we think, and then we can use our knowledge of anatomy to kind of localize what we're learning and then make some decisions about how to proceed. If you do the next slide, I think it's one other view of this, body talk framework. And it kind of looks complex, but basically it's pretty straightforward. We gather information from the people and the horse, and then we harness it using our, knowledge of anatomy, and then use critical reasoning to think about what did we learn from the horse and our own sensory and the people, and then how does that correlate with primary issues. This works. I use it for when I think there's some tack fit issue, but really I use it for the whole thing. And if it's whatever, it's like, you get in a car accident and you bang your head and you break your arm and you stub your toe. Well, you got to triage that. Which one are you going to fit first? And we never have just one thing going on with a horse. And so this is a system I use. And then, in the end, then we start talking. So the reason I developed it is because my brain wants order, and
Yes.
my brain wants way too much information, and my personal inclination is to barge ahead. So
Mm,
I needed to. I thought it was beneficial to have a sort of organized process to help myself from, because our inclination probably is to go from the top line all the way to the bottom to start talking to
yes.
people. And they might not be ready to hear, and we might not know everything we need to know. And so having a sort of organized system helps my brain, and I've found that it's helping other people too. So
I really love that. Okay, I really love that. You kind of mentioned the pause and confirm and your personal inclination to just barge ahead. So I love that because you kind of identified that thing in yourself that you tend to do, which can lead to jumping to conclusions or getting to something too quickly and then being inaccurate because you don't have the full picture. And so you've worked in that stop, pause, wait, confirm, what are the next steps. I really love that system. Thank you.
yeah.
I think many of us have the same thing. Yeah. Okay, can you talk to us about, like, let's apply this to
Yeah.
a specific tack dysfunction. So we have a saddle fit issue. Can you walk us through how you're going to apply this framework in that context?
Sure. And I don't remember what's on the next slide, if that could be useful to us. If not, let's just see what the next. Well, that's just a summary. Let's stop right here for a sec. So,
Okay.
um, I my fundamental notion is that that horses are communicating actively, and
Mm,
that whether it's a particular saddle fit issue, um, that may not jump out at us right away. It might be
mm,
confusing. We may not know. And I'm thinking in particular with this course that I teach, there was a horse that I was brought in with that the you know I sometimes I have people contact me and say I have a saddle fit problem, but other times,
mm,
more often than not, they have some sort of a performance dilemma, or there's
mm,
some niggling, like I don't know what's going on. And this particular case study horse that's in this course, I was called in by the trainer, and she was like, I don't know, I need another set of eyes. And
mm,
so I think even if whether I have person A who says I have a saddle fit problem, or person B who says I don't know what all the data is telling me. There's just too much data. I'm
mm,
confused. I listen and I go, absolutely, I'm going to come, but then I do my own intake. And
mm,
so I think it's super valuable to get the information from the horse's people. I want it all. I want all the things that you are concerned about, you're observing, you're seeing, you're worried about, especially saddle. Have it here. I want to be able to take a look at it. But then I want to pump the brakes and I want to talk to the horse. The image
mm,
that just came in my head is when my children were little, I would take them to the doctor, and it would be the doctor, my child, and me. And the doctor
mm.
would ask me what's going on, and then the doctor would turn to my child, even when they were 5, and say,
Yeah,
"Tell me what's going on." And so that's
yeah.
kind of what I liken it to. I'm getting information from everybody, and so even when there's a report of a saddle,
Mm,
because just like I said with Dr. Dyson, the
mm,
saddle issue might be a hind limb issue, and so I have this very broad process that I go through to gather information from the people and then to check in with the horse. And so, these are the kinds of categories that we can have. There can be, behavior performance issues. that orange one is the one that perhaps that we're more ready to jump into as, physical
Mm.
therapists or body workers or, even vets, being called out, like, we dive right in. And so we're looking at whatever the horse's tissue is, or we might be looking at what their posture is. And so I think, for me, I want to get all the information from the horse and from the human and put that together. Can you just share with me what the next slide is? Because that might help us in terms of my process. Yeah, so that's just diving a little deeper in each of those. What I end up doing is putting all the information together to, and how we listen. Um, and I will also include the implement. So if it's a saddle, if I have I begin to get to the part where, this one case study, it was actually sort of perfect for this topic and teaching people, because the saddle was new. Literally,
Yeah.
it had been there weeks. And so when I did there was altered movement. So if we look at this list with that horse, there was altered movement. It was short striding in the right hind, and the rider
Mm.
felt it and the trainer saw it. And it was resistant in when I asked for the horse to do, horse's body to do things, it was resistant, but they reported that it was resistant and picking up a lead.
Mm.
And so then there was this altered appearance, and actually it had a right scapula on top that was a little larger than the left. And in terms of, he was a rock star. He's one of those horses that was like, hold my beer, coach, and throw me in. Doesn't the performance? There were no problems with performance. This horse is such a gentleman.
Yeah.
His leg could be falling off, and he would be like, "Oh, what can I do for you today?" So the behavior and performance were not helpful, but the
Mm.
movement was. And so then I said, "Well, can I take a look at the saddle?" And whenever I do that, I ask the person to put their own saddle on, because I want to observe how they do that. And so she did a very nice job. She put it on, and so then I looked at it on the left side of the horse, that sort of that vertical panel compared to the scapula shoulder area, not shoulder, but the upper area.
Mm.
And then I went around to the right, and on the left it was like two pancakes sitting on top of each other, and on the right it was like, a bottle sitting on top. It didn't fit at all, and it
Okay.
was brand new. And so that one felt sort of easy. But
Yeah.
then we get to the communication part, because I'm telling you, that saddle was an easy estimate of $9,000. And
Mm.
so the trainer and the owner were standing there, and I said, what, look at this. What do you see? So we're jumping ahead to the communication, but
Mm.
I engaged the people in observing what I can observe that the horse's body is saying, and
Mm.
any implements. And so they looked on the left, and I like, run your hand down there. And they're like, yeah, that feels pretty good. I'm like, okay, what do you see over there? And they're like, well, it looks different. And I'm like, yeah, I agree with you. What do you notice? And they're like, well, this side it's really flat and that side it's not. I'm like, I agree. And so I took
Mm.
the saddle off, and I said, we can see on your horse, there's a difference. Look here to look there. I'm
Mm.
like, oh, yeah, there is. What's that? I'm like, well, it just is. We'll just leave that for right now. And then I looked at the saddle, and
Mm.
it was like, Mary and Frank each did one half of the saddle. It was completely different. The panels were different.
Okay.
And so, that one was actually pretty easy. Um,
Yeah.
because then they could just they called the saddle maker and had him come fix it. But um
Yeah.
so that's a very collapsed version of how
Mm.
I do that. But I think the through line is, it's about communication. It's 100% about communication.
Mm.
And
Okay.
I'm inviting the horse into the dialogue.
Into that dialogue. Okay, so let's talk a little bit more about communication, because um, especially when we're thinking about tack, now we're talking about multiple professionals that we need to work together with. as a team, the owner, the trainer, sometimes the rider, because they might be different people, and the veterinarian potentially, depending on how much pain there is, and a fitter, right?
Yeah.
The appropriate fitter for whatever piece of tack we're looking at. So, what are the biggest challenges that you encounter when it comes to communication? And then
Yeah.
how do you make sure that the team stays cohesive in terms of everyone's on the same page and we're communicating clearly?
Yeah. Why don't we turn the slides off for a sec? Um, yeah, um, I got to tell you that the peopling part, it's
Mm,
really hard. And um, um, I, I have a really long CV, and I've learned so many things. No one in any of those courses, even in my saddle fit training, nobody talked to you about how to people and how to talk to people. And this
mm,
question you've just asked, I went there with this class that I developed because, that's the hardest part. It really, I think, you know, because you have the challenges are that everybody has their knowledge, everybody has their beliefs, everybody has their processes. There is an institutional hierarchy which ought to be there, that, veterinarians ought to be at the top, because they're the ones who've been trained. And I don't need to tell everybody, they need to be able to diagnose.
mm.
Um, and yet, I think humility on everybody's part is really, really important because, I don't know everything, and I've met some remarkable people, but nobody knows everything. And
Mm,
and there are people who have specialties. And so, the best situation is when you have a circle of care that is populated by people who understand what they understand and are grateful for the people who know more than they do, on topics that they don't understand. And then finally, that circle of care team really wants to be a team, and that everybody's focused on what is the
mm,
best possible outcome today
mm.
for this horse individual. So, if you have all of those right, you still can screw it up if you're an idiot in how you talk. so, so,
Yeah.
it's a tall order to make sure everybody's brought together. I am
Mm,
blessed with really being able to work with um, pretty close to what I described. I think it
mm,
fundamentally starts with, you know, people who have their horse's best interest in mind. And so,
mm.
if if I think about the through line of um, how you keep everybody engaged, is to keep everybody focused on the horse. That's
Yeah.
that's fundamentally everybody focused on the horse. And then, one of the things that I've learned from the Masterson teaching that we do is we just keep asking a lot of questions. And that
Mm,
is how our body work sessions go. We are working with the horse, which means I'm responsible for the work plan, and then I ask you a question, and you, horse, are responsible for telling me it's a good plan or a stupid plan, in terms of the order I'm doing, or the presence I'm using, the pressure I'm using. And then I have to be humble and go, oh,
mm,
I guess I need to be softer. I need to be, and so if I work to keep the horse in the center. And then, I think for me, I really try to lean into where people's strengths are. I listen to where their gaps are. When I
mm,
ask an owner, talk to me about your horse when you're grooming, because if I'm really concerned about a tack fit problem, I'm gonna know, based on how I'm going to know when the person walks up with their saddle, because I'm not going to watch the person. I'm going to watch the horse. You will know when the tack
mm,
starts walking out, because of how they
mm,
start behaving. And so, if they're a jerk when they're being groomed, then that's telling me something. And so the
mm,
fact that an owner doesn't know that, that's just simply they don't know. And so I think
mm,
that's the other piece is that I give people the benefit of the doubt and try to understand, where are they in their learning journey. And part of that is through humility. I mean, what I know now and what I hear, myself explaining now, I so did not know 16 years ago. And so my 16 years ago me um, knew all kinds of things, but was not humble about all kinds of things I didn't know. so,
Mm.
so my own journey has helped me to just try to understand where people are in their knowledge journey and how do we, on behalf of the horse, with the horse in the center, how do we move forward and get the best outcome today. And so, that's about asking questions and I mean, the best scenario is that the one that I described with that horse. I knew that fast what the problemo was. But that didn't help them in their knowledge. That didn't
Yes.
help. And I didn't have to say it. The horse's body said
Mm.
it and the saddle said it. So
Mm.
I my safety zone is acting as a translator because it's not me. It's the horse. It's the saddle.
Yeah.
And so I love being a translator. I love gathering the talk, the body talk. I love gathering the tack talk. I have I'll test a saddle and I'm like, woo, that thing's broken. And so like the tree's broken. I can feel it. I can hear it. And so I'll engage other people in that one moment. I'll say, try this. And they're like, what is that?
Mm.
Why is it doing that? I'm like, well, that feels a little compromised. Again, I'm so trained not to diagnose and step out of bounds. I'll just go,
Mm.
that feels, and so, knowing our boundaries, knowing what we know, knowing what we don't know, leaning
Yeah.
into the other professionals on the care team, and really pushing forward the horse's communication and if there's any tack communication. And that particular case study, after we figured out the saddle was a trouble, I looked at the rider and she was like this and she had this twisty thing going on.
Yeah.
And so then I said, we didn't get a chance to talk about you. How's your body? Are you challenged in your body by anything? Oh yeah, I broke my ankle. No, no, no. And I was like, so how long ago did you break your ankle? And it was like, I don't know, 4 months ago. And I'm like, oh, um,
Oh.
are you still working on that? And she's like, well, yeah, but PT. And I'm like, and so then I said, well, is the PT working only on your ankle? And she said, yes, but I'm supposed to be doing these other things too. And I said, well, is it okay with you if I just look at you? And she's like, sure, yeah.
Yeah.
And I mean, I already had, but, but, and so
Yes.
I just, I said, well, here's what I can see. I can see that you're compensating, your body's compensating and you have, some differences in the heights of your shoulder and where your pelvis is.
Mm.
And the trainer's like, yeah, she really leans hard on the saddle on that side. I'm like, well, that all makes
Mm.
sense. And so then I just turned back to
Mm.
her and I said, how are you doing on your whole body fitness program? And she's like, because I said, I
Mm.
can feel it in the horse's body. What y'all just
Mm.
said and what we talked about with your body, I feel it in the horse's body. And you reported it. You said it was hard for him to bend that way. And it's the same way it's hard for you to bend.
Mm.
And she's like, oh,
Mm.
I guess I should get back to my stuff. I'm like, yeah,
Mm.
that would be good. So, it's noticing and engaging, everybody on the
Mm.
care team, including the owner.
Okay, no, I really love that. I keep a focus on the horse, keep asking questions. I love how you direct the observations to the owner instead of telling her what you see, you ask them to see what you're seeing and you show them how to see what you're seeing. I think that's very powerful
Yeah.
in terms of creating trust and creating understanding in the owner, which ultimately will help with compliance and better outcomes. But it's also just really powerful in terms of how you're carrying yourself and how you are appearing or showing up for your clients. So I love that. We have a few people live with us, and I just want to say hi. So Jessica Ann Newman, she shared a few additional things that could add to that primary issue overwhelm, like birth neurological issues, just like kids, and environmental factors like the soil. Julie Perso, it's so great to have you with us. She's saying, in terms of our communication, it's hard to be on the same page. Sometimes one of the pros or two don't see what you see, and then the communication channel stops there. That's really true. So I think you've given us some really good ways to work with that. I love the idea of developing a team of professionals around yourself that you have a really strong relationship with already, that you can lean on for as a referral network and as a consulting network, but you always have to also work with whoever the owner is working with. Um, and then it's an opportunity to just expand that network of trusted professionals to work with. So I like that. Thank you.
Yeah.
Guys, if you have any questions, if you're joining us live, please share them. We have a few more minutes with Becky. But I don't want to keep you too long, Becky, because I know you have a full day today. So for rehab professionals who want to become more confident assessing tack-related dysfunction, where would you encourage them to start? What skills or mindset set shifts have made the biggest difference in your own practice, and where can they learn from you?
So I think the biggest, what was your question? The biggest,
What has been like the skill or the mindset set shift that's made the biggest difference for you?
yeah, I think making the horse primary has been the
Mm,
biggest shift. And but that what that means is I have to get smarter. And so I have to have more knowledge about anatomy and how the what the connected body looks like, so that
mm,
I don't simply focus in. Yeah, so that I would say that, and then understanding that horses lie. It's they have a survival need to lie. They conceal. They're masters at compensation, and
mm,
and they have a survival need not to show their pain. And
mm,
so what that means in practice is that where it's screaming is not where it started, unless there's
mm,
been some acute issue. And so, when it shows up lame, and nothing changed, they didn't step in a hole, then what that means that the source is somewhere else. And so recognizing that survival need that horses have, um, causes me to be humble again about
mm,
where I like, ooh, coach, I know where it is. It's right there. Well, no, that yes, you do that. The horse does have a problem right there, but
mm,
that perhaps is not where it started. So you need to go back.
mm,
And so that goes back to the connected body, the understanding of
mm,
anatomy and the understanding of the connected body and how and the compensation. If it's doing that, then maybe
mm,
it's not that end, maybe it's the other end, and so
mm,
um and then the other piece that has really helped me is really recognizing and categorizing the way I have leaned into now is all the different ways that the horse communicates, that we put into, as humans, we can tend to put into bad behavior, or it's a
mm,
performance problem and they just need to work harder, and like and so becoming very conversant in what, the horse's body performance behavior, what I call body talk, what is it saying,
mm,
and what is it saying when we're not touching them, when they're just in a field, when they're conducting themselves, in life, what can we learn?
mm,
And so I think, those, um it's a tall order, but it's an ongoing process. I mean, I've been at this for 15 years and I learn something new from every horse that I go to. And as you noted a while ago, I'm sort of manic about continuing to learn, because once I learn whatever I point my face at, then it reveals all kinds of other things down that path. I'm like, well, right, but how do I do that? And so I think choosing to continue to learn. I think those are the things that are most helpful to people in setting themselves up in a way to continue to go forward. And so, in terms of learning from me, I think we have a slide late in the thing. I have one particular class, this one actually, that I do online. It's an online live, and then I have other ones that so toward the end, I think you and I looked at it at the beginning. um, I I
Beneath
have
the
a website.
letter.
Yeah, so this is where I go through. It's a 2 day um, online live class. It's set up for U.S. time zones, or North American time zones. If there were
Mhm.
a group of people that wanted to do this that were not in our time zones, I could cut it up into we could figure it out. But yeah, so there's this class, and the way to learn about these is my website. You can see it. That's the base there for that class, and then
I've,
another. But it's
I've shared the
equinebodyworksusa.com.
link in the comments as well.
I'm sorry,
I've
what?
shared the link directly in the comments so
Okay.
that they can click on it right from the comments.
Yeah, yeah.
Okay.
So that's my one online class right now. I have other in-person classes, and I probably will be creating a situation, but I don't have it existing right now, where some of the classes I'm teaching in person now, I'll sort out how to put online. So I know we have
Okay.
a worldwide audience here. So
Okay, amazing. Becky, thank you so much for sharing that with us. I've really enjoyed the webinar that you presented for our members this month. So guys, if you want to watch that, it is in the Online Pet Health Equine Members Portal. Please go check it out. Very valuable stuff. And then Becky, thank you for sharing your course here. When are the next dates? When's the next course running?
yes, this particular one is at the end of the month.
Okay.
Let me just, it's to the 29th and 30th of August. And then I have two other dates. I have October dates and December dates. Obviously, all of those were keyed off of US time zones, but end of August is
Okay.
the next run of this one.
Awesome. If you guys are watching this as a recording, please feel free to share any questions or comments or experiences with us in the comments section, and we'll check in on those. And yeah, Becky, again, just thank you so much for your time. It's been really great chatting to you.
I really appreciate the invitation to present to the online pet health uh, people, all of your members, and it's been lovely getting back together with you. It's, I don't know, 3 years or so since we chatted before,
Oh my
and
goodness, time
it's
flies.
it does. It's remarkable. But I really appreciate you inviting me.
Awesome. Have a great day, everyone. Bye.
Bye.